Dear student, myself Arif Khan, working as a senior lecturer, MCU Society, Institute of Pharmacy, Diploma Azim Campus, Camp Pune. In this video, we are going to deal with the antimycobacterial agents. Actually, this is the first part, and antimycobacterial agent include two types of drugs, that is anti-tubercular drugs as well as anti-leprotic drugs, and both which are acting on the mycobacterias, which are acting against the mycobacterias. That's why these commonly called as antimycobacterial agents. So first we are going to see what are mycobacterias. Mycobacterias are the transition forms of the bacteria between the bacteria and fungi, and they are characterized by non-motile, non-sporulating rod shape, and they doesn't decolorize by the acidified organic solvent, and hence they are called as acid-fast bacteria. So basically these are mycobacteria. Myco stand for fungus. Bacteria means the bacteria means they're having both the characteristics of the fungus as well as the bacteria, and that's why these are called as mycobacteria, and these are the transition form between the bacteria and fungi. That's why these are more resistant as compared to the normal bacteria. Mycobacteria are more resistant because they are having additional characteristic of the fungus also. So this is about the mycobacteria. Now we are moving towards the first category of the drug, which are antimycobacterial. That is first one, anti-tubercular drug. Anti-tubercular drug. So directly going to the anti-tubercular drug, we'll see the first, what is TB. What is tuberculosis? Tuberculosis is a chronic infection which is a communicable one, which is caused by the Mycobacterium tuberculosis or Mycobacterium TB. As far as the symptoms are concerned, the inflammation of the lungs and infiltration of the tubercle formation and the fibrosis, which is affected on the respiratory tract. So particularly this infection is respiratory tract infection, which is a communicable type of infection, and it's a chronic infection caused by Mycobacterium tuberculosis. Now, the primary tuberculosis is spread through the bloodstream and mainly meningi, bone and genitourinary tract. This we call as secondary tuberculosis, or this we are calling extrapulmonary tuberculosis. Normally, if the infection is limited to lungs, that is called as pulmonary tuberculosis. If it is being spread through the blood circulation to the other tissues, then it is called as extrapulmonary tuberculosis. So post-primary tuberculosis leads to necrosis, ulceration and cavitization to give the extensive lesions. So this is regarding the extrapulmonary tuberculosis. Now we are talking about the pulmonary tuberculosis. So actually there is a formation of the granulomas on the lungs wherever there is a growth of mycobacteria, and due to that they are forming these type of structures. The lungs are majorly affected by these disease called as tuberculosis. These granulomas are being developed overall the lungs, and that's why this appear like a tubers. That's why the term comes tuberculosis. Okay, so this is all about the tuberculosis, physiology of tuberculosis. Now we are moving towards the drugs which are used in the treatment of tuberculosis. These are called as anti-tubercular drugs, or the agents used in the treatment of tuberculosis are called as anti-tubercular drugs. So in that, first is the para-aminosalicylic acid and its derivative, that is analog of para-aminosalicylic acid. So in that, first example is para-aminosalicylic acid, PAS itself an example. Next, pyridine derivative, in which the Isoniazid and ethionamide, these two are the example which having pyridine in its structure. Next, pyrazine derivative, pyrazinamide, it is an example. Ethylene diamine derivative, ethambutol, it is an example. And the antibiotics which are used in the tuberculosis, these are called as anti-tubercular antibiotics. Examples: cycloserine, streptomycin and rifampicin. So this is a chemical classification of the anti-tubercular drugs or the agent, in which it's showing the presence of the nucleus, para-aminosalicylic acid, pyridine ring, pyrazine ring, ethylene diamine and the antibiotics. So this is an chemical classification of the anti-tubercular agents. Now second way to classify these anti-tubercular agents are depending upon the line of treatment, first line treatment and the second line treatment. So in that, first line treatments are what they are well tolerated and have the less incidence of side effects. First line treatments are primary line treatment, and that's why they are preferred, because they are well tolerated with the body and they have less incidence of side effects. That's why these are categorized into the first line agents or first line treatment of of TB. So example includes isoniazid, rifampicin, pyrazinamide, ethambutol, and streptomycin. All these five drugs are used as first line treatment of tuberculosis, or these are first line treatment or first line anti-tubercular agent. Now, as far as the second line tubercular agent or anti-tubercular agents, so second line, they are less tolerated and have the higher incidence of adverse effects, and they are used when if there is a say resistance or intolerance by the first line treatment. So if the first line treatment got developed the resistance, in that case we are shifting on the second line treatment, and second line treatments are not well tolerated, and they have the high incidence of side effects or adverse effect. That's why they are not used primarily or first line. They may be used in the second time, or due to the resistance developed by the first line, second line drugs are useful. Example includes ethionamide, kanamycin, and cycloserine. These are the examples which are used in the second line treatment of the tuberculosis. Next one, so amongst the chemical agents of the drugs, first drug that we are going to deal, that is isoniazid, which is the most popular drug and the primary line treatment or first line treatment of the tuberculosis. This drug is most useful. Isoniazid, it having synonym INH, stand for isoniazid, isonicotinic acid hydrazide. Isonicotinic acid because as far as the structure is concerned, these basically isonicotinic acid derivative, isonicotinic, then hydrazide. That's why isonicotinic acid hydrazide, isonicotinohydrazide, or isonicotinyl hydrazide. These all are the terms include for this isoniazid. So basically pyridine with COH is called as, when the pyridine having COH group at third position, that is called as nicotinic acid. When the COH group at fourth position is called as isonicotinic acid. And on this isonicotinic acid there is a say hydrazide, NH2 or NH2 is called as hydrazine. When it is formed hydrazide or amide with this acid, this isonicotinic acid is called as isonicotinyl hydrazide. Now, as far as the chemical name is concerned, the parent nucleus is pyridine. On the fourth position of pyridine, there is a say carbohydrazide. So 4-carbohydrazide pyridine or pyridine 4-carbohydrazide will be the chemical name of INH or isoniazid. Now, as far as the physical properties of this isoniazid is concerned, it is colorless, odorless, sweet taste followed by the bitterness. Next, nature crystalline powder soluble in water. As far as the first chemical properties, when isoniazid is treated, the bromine water in presence of the hydrochloric acid is converted into a isonicotinic acid with the liberation of nitrogen gas. You see that this is a isonicotinic acid hydrazide, that is isoniazid. When it's treated with the bromine water, it converted into isonicotinic acid. This is pyridine at the fourth position. COH group is called as isonicotinic acid. So isonicotinic acid, there is a formation of isonicotinic acid plus there is a say liberation of the nitrogen gas. You can see N2 is the nitrogen gas which will get liberated and which will leave back the residue of isonicotinic acid with which it is made up of. Next, isoniazid is treated with the benzene sulfonyl chloride, this one. So it will convert to a benzene sulfonyl derivative. There is a fusion and there is a formation of benzene sulfonyl derivative. Third property is not too much important one. For former two are important one. Yeah, we can take any of the two chemical properties of the isoniazid. Next, as far as the stability storage condition, it should be stored in tightly closed light resistance container. And uses, first, it is a primarily used as a pulmonary tuberculosis in the treatment of pulmonary tuberculosis. Extrapulmonary tuberculosis or lesions, again these drug isoniazid can be useful, which include the meningeal or genitourinary infection of the tuberculosis. Then lupus vulgaris, it is actually chronic direct infection of the skin with the tuberculosis causing dark red patches on the skin. That is called as lupus vulgaris. This again the relative to the skin. That's why this antimycobacterial agent, particularly the anti-tubercular agents, can be useful. Next, as isoniazid develop the resistance within a few weeks, it is given in combination with the ethambutol and rifampicin or streptomycin. That is in a combination. So in order to avoid the resistance develop within few weeks, one can use in combination with these other drugs, that is ethambutol, rifampicin, and streptomycin. Next, pharmaceutical formulations are available as a syrup, elixir, tablet, then granules, powder, tablet, all these, and injection also. All wide variety of formulations are available, because in the chronic disease we have to take a treatment, or patient have to take a treatment of or an isoniazid therapy or the drugs that for the long period of time. That's why the formulations, a wide variety of formulation as well as oral formulations are available. As far as the brands are concerned, then Cadizid, Isonex, Ripanzid, and Isocadipaz. These are the brands for Isoniazid. Next drug, that is the para-amino salicylic acid derivative, or that is also called as itself a drug, para-amino salicylic acid, PAS. Now this is the structure of para-amino salicylic acid. When the benzene ring with the COH is called as benzoic acid. Benzoic acid having hydroxy group on the ortho position is called as salicylic acid. And if you are going to deal with the salicylic acid on the 4 position, there is an amino group, that's why it's called as, or on the para position there is an amino group, that's why para-amino salicylic acid. So if in order to give the chemical name, we will take a benzoic acid as a parent nucleus, that is benzene with COH group. Benzene with COH group, that is a parent nucleus that we have to take, and we have to give the numbering by this anti-clockwise way, so that the last substituent get the least number as well as all substituent will get the least set of number. Then in this case, benzoic acid is a parent nucleus. At the second position of benzoic acid there is a hydroxy, fourth position there is an amino. Alphabetically we will take amino first, then we will arrange the alphabetically hydroxy after the amino group. So we are calling 4-amino to hydroxy benzoic acid is a chemical name for para-amino salicylic acid. Now this was about the structure and the chemical name of para-amino salicylic acid. Now as far as the physical properties are concerned, color which is a white or to yellowish white, odorless, light acidic in taste, crystalline powder, slightly soluble in water. Next, the most important chemical property of these para-amino salicylic acid is that the diazotization reaction. So what is this diazotization reaction? So when para-amino salicylic acid is treated with the sodium nitrite in presence of hydrochloric acid at a temperature condition 0 to 10 degrees Celsius, the primary amino group is converted into a diazo group. So this diazotization reaction shown by all the aromatic compound which has the primary amino group, that is NH2. This NH2 is the primary amino group on the aromatic ring, so those will have this primary amino group will show this diazotization reaction. What are the chemical reagents involved? Sodium nitrate and hydrochloric acid. Sodium nitrate and hydrochloric acid will react to form the primary product, which will which will cause the diazotization of this given compound. Now you can see that there is a formation of diazo linkage, that is 2 nitrogen diazo double bonded 2 nitrogen, that is called as diazo linkage. The formation of diazo linkage, in this reaction the diazo compound are forming, which has what are diazo compounds? The compound which has diazo linkage. What is diazo linkage? Double bonded nitrogens or 2 nitrogens which are double bonded are called as diazo linkage, which has those compound which has this linkage is called as diazo compound, and the reaction in which the diazo compounds are forming, these reaction is called as diazotization reaction. For these the temperature condition required 0 to 10 degree Celsius. So this shown by all the aromatic compounds which has a primary amino group, and as these para-amino salicylic acid has the primary amino group will show this reaction. Next, second chemical reaction, when PAS is heated with soda lime, the decarboxylation reaction occur having para-amino phenol. It means that say decarboxylation is being occur and there is a formation of para-amino phenol is meta-amino phenol is being forming M-amino phenol, that meta-amino phenol is being forming as a product. Next, it is oxidized by air also. Air and oxygen formation of the brown color or black pigmentation is being forming, that is again the decomposition reaction of the para-amino salicylic acid. Now as far as the storage condition is concerned, it should be stored in tightly closed resistance container. It is used as a primary line treatment for the treatment of tuberculosis. It is generally given in combination with the isoniazid and streptomycin for the better effect in order to prevent the resistance developed by the mycobacteria or Mycobacterium tuberculosis. So one can use this drug in combination with the isoniazid or streptomycin or other antibiotics. Formulations: amino salicylic acid is called as, actually amino salicylic acid stand for para-amino salicylic acid. Amino salicylic acid tablet, amino salicylic acid sodium tablet, then most of the tablets are there. ID PAS, isoparan, benz pass, benzapaz, these are the brands for the given drug, that is para-amino salicylic acid. Now next drug, we'll see the remaining drugs we have to see in the next part of these anti-tubercular agents. Thank you student, thanks for watching, thanks for being with us. Thank you so much.